In the event of an overdose from synthetic opioids, like fentanyl, or non-synthetic opioids, it's important to have an overdose rescue medication like Opvee ready and know how to use it. Watch out for the signs of an opioid overdose: unusual sleepiness, lack of consciousness, limp body, slow or shallow breathing, gurgling noises while breathing, or no signs of breath at all, very small pupils, sometimes called pinpoint pupils, or a slower than usual heartbeat. Administer Opvee as quickly as possible if you suspect an opioid overdose, even if you are not sure, because an opioid emergency can cause severe injury or death. Here are the steps to take to use Opvee. Shout "wake up" and shake the person gently. If there is no response, slow breathing, or no breathing, lay the person flat on their back. Remove an Opvee device from the package and hold it with your fingers on both sides of the nozzle and your thumb on the plunger. Do not press the plunger yet. Provide support to the back of their neck to allow the head to tilt back. Gently insert the nozzle into one nostril until your fingers on either side of the nozzle are against the bottom of the person's nose. Firmly press the plunger all the way down until it stops. Once the dose has been delivered, remove the device from the nose. Call 911 or request emergency medical assistance as soon as possible after giving the first dose of Opvee. Move the person onto their side and into the recovery position, with their hand supporting their head. Bend their knee and turn their face to the side. Watch the person carefully. Wait 2 to 5 minutes to see if the person wakes up or if their breathing returns to normal. If they do not wake up or do not start breathing normally, give them another dose of Opvee in the other nostril using a new Opvee device. Remember, give 1 dose of Opvee and wait at least 2 minutes before the next dose. Stay with the person until emergency medical help arrives. Know how to handle Opvee so that you are ready in case of an opioid overdose. Do not test the device or open individual blister packs before using. Be sure to keep Opvee in its blister in the box and store it at room temperature between 59 and 77 degrees Fahrenheit. Opvee can be exposed to temperatures as low as 39 degrees and as high as 104 degrees for less than 24 hours. Be prepared to recognize an opioid overdose so that you can administer Opvee right away and care for the person who is overdosing until help arrives. Important safety information. Contraindication: do not use in patients who are allergic to nalmefene or any of the other ingredients. Warnings and precautions. Risk of recurrent respiratory and central nervous system depression. While the duration of action of nalmefene is as long as most opioids, a recurrence of slowed breathing, respiratory depression, is possible after treatment with Opvee. Watch patients and give repeat doses of Opvee using a new device, as necessary, while awaiting emergency medical assistance. Risk of limited efficacy with partial agonists or mixed agonist-antagonists. Improvement in respiratory depression caused by medicines such as buprenorphine and pentazocine may not be complete. Repeat doses of Opvee may be required. Precipitation of severe opioid withdrawal. Use in patients who are opioid dependent may cause symptoms of opioid withdrawal like body aches, fever, sweating, runny nose, sneezing, goosebumps, yawning, weakness, shivering or trembling, nervousness, restlessness or irritability, diarrhea, nausea or vomiting, abdominal cramps, increased blood pressure, and rapid heart rate. Some patients may become aggressive when an opioid overdose is treated. Abrupt postoperative reversal of opioid depression may result in adverse cardiovascular CV effects. These events have primarily occurred in patients with pre-existing CV disorders or who received other drugs with similar adverse CV effects. Monitor these patients closely in an appropriate healthcare setting. In newborns, opioid withdrawal may be life-threatening if not recognized and properly treated, and may also include convulsions, excessive crying, and hyperactive reflexes. Monitor for symptoms of opioid withdrawal. Risk of opioid overdose from attempts to overcome the blockade. Taking large or repeated doses of opioids, such as heroin or prescription pain pills to overcome blockade, may lead to opioid intoxication and death. Adverse reactions. Most common adverse reactions, incidence at least 2%, are nasal discomfort, headache, nausea, dizziness, hot flush, vomiting, anxiety, fatigue, nasal congestion, throat irritation, pain in the nose, decreased appetite, changes in sense of taste, skin redness, and increased sweating. To report a pregnancy or side effects associated with taking Opvee or any safety-related information, product complaint, request for medical information, or product query, please contact Patient Safety NA at indivior.com or 1-877-782-6966. You are encouraged to report negative side effects of drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. To see full prescribing information or for more information about Opvee, visit www.opvee.com. Be ready with Opvee.